Chairman, we are ready to begin.
Thank you, Denisha. If you will call the roll, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Cynthia Rucker,
Here.
Tommy Hopkins,
Here.
Norman Boyd,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Kathleen Ruth.
Here.
Chairman, that concludes my roll call.
Well, good morning, everyone. Sounds like we're at 100% this morning. That's great. Everyone was provided the minutes from January the 9th. I'd ask our Board Secretary, Dr. Tommy Hopkins, for his approval.
The minutes have been reviewed and have been sent to the members prior to this meeting, and I recommend we move to approve those minutes.
I have a motion for approval. Do I hear a second?
Shane Mobley seconds.
Mr. Mobley has seconded. All those in favor of the motion signify by aye.
Aye.
All opposed, no. The minutes are approved. Well, happy February, everyone. If we're here smack dab in the middle of February, you need a general reminder, today is Valentine's Day Eve. So if you need a general reminder that you need to do something for someone, this is the only warning I will give. We have 4 items to consider today, 2 for final adoption, 2 for initial adoption, and we'll move into that shortly. We know the legislative session's in full swing, and I'm sure the commissioner's got some updates from that. So Commissioner Carlson, we'll move right into your report if you're ready.
Yes, sir, Mr. Chairman. And I personally want to thank you for that reminder. I'll just leave it at that. Good morning, Mr. Chairman, members of the board, and those of us joining virtually today. We are, as always, at the Sloppy Floyd building across the street from the state capitol. And as the chairman alluded to, the legislature preparing to convene for Legislative Day 17 of 40. Not that we're keeping up with that sort of thing, but 17 of 40. And as it stands now, crossover day, which is the 28th legislative day now, that's set to fall on Thursday, March 6th, with Sine Die Day 40 falling on April 4th. So while we're always grateful for the aggressive calendar that gets us out early in the spring, we know that when you're in the throes of that, that comes at a bit of a cost with quick turnarounds, aggressive schedules and whatnot. But given that our entire DCH team continues to prepare for appropriations hearing and multiple quick turnarounds on bill analysis and fiscal impacts, and we're very grateful for the government relations team led by Brandy Sullivan, but also literally dozens of subject matter experts that help turn around analysis on very short notice. Obviously, the very grateful to OPB and the governor's office for their support and counsel. And in these early stages of session, especially want to thank the House and Senate budget offices for their ongoing collaboration. So as you alluded to, Mr. Chairman, we've been testifying throughout the week, been wrapping up work on the amended budget as we've presented to both the House and Senate Appropriations Committees. And the full Senate Appropriations Committee will take action on the amended budget in the days ahead, but we already have a date on the calendar for next week to begin working in the House with the quote unquote big budget, the FY26 budget, which will be a broader discussion on all the priorities and work going on over here. But another layer of intrigue, if you will, to an already busy session is the transitions we're all following in DC. It's no secret that healthcare funding in general has been the subject of a great deal of conversation. And thus far, DCH has generally been able to maintain steady operations, but there are still things that we obviously are keeping a close eye on. But I'll say this, these past few weeks have been yet another reminder that relationships matter. And while we cannot always control what happens at the federal level, we are blessed with a steady and reliable flow of information from federal officials of all stripes and positions that have been keeping us informed and allow us time to assess potential impacts and provide feedback before these decisions are finalized. So while you cannot always control the outcome, it's good to feel that on any given day, you're more often than not going to be surprised. And that's all we could ask for. But before we move on to today's agenda, Mr. Chairman, I'd like to just take a moment, as we always do, to honor some of these employee milestones. And we have some big hitters this month. Calandra Gamble, OIG, 25 years. That's so grateful for that kind of service. But we also have 5 20-year veterans of the state of Georgia before us, starting with Yolanda Smith at HFRD, Jamia Everson, HFRD, Gilletta Gray, MAP, Katrina Williams, Office of Health Planning, and Lynette Rhodes, Chief Health Policy Officer, also at 20 years. So I want to thank all 5 of those 20-year milestones, along with the aforementioned 25-year with Ms. Gamble, and now a 15-year milestone in OP with Ramakant Ralapali. And then, as we always do, we want to take a minute to sincerely thank our 1-year milestones for individuals that have joined the team and have already been contributing. Freeman Montague with the Georgia Board of Healthcare Workforce, Stuart Portman, our MAP director. I'll still continue to call him our new MAP director just because it feels right. But and Courtney Bunton and HFRD, grateful for all their service and their substantive contribution to the team in this short amount of time. So very grateful that you're here. And Mr. Chairman, with that, I'll hand it back to you for the agenda. Thank you.
Thank you. Any questions for the commissioner from any of the board members? Well, hearing that, on behalf of the board, we certainly want to recognize each of those employees also. That's great. Great number of employees reaching significant milestones. First item on the agenda, we'll get started with our business. The first item on the agenda is the Medical Assistance Plan, State Plan Amendment, Therapeutic Care Model. Michael Smith, Director of Behavioral Health Medical Assistance Plans, will present to us. Michael.
Thank you, Mr. Chairman, Commissioner, members of the board. Today, I'm presenting for final adoption an amendment to the Medicaid state plan to include therapeutic care models, abbreviated TCM, effective July 1st, 2026. Therapeutic care models are a multidisciplinary, whole person-centered, and community-based program designed to reduce residential treatment for the state's most vulnerable young people. TCMs are also uniquely positioned to shepherd this population through their emerging adulthood and into stable and sustainable community placements following system age out or after 21. The TCM is modular. It contains core components and add-on components. The core and add-on components in the full model will be available in the SPA. MIDI iterations of the model can be developed and built depending on the needs of the member and the provider community. During the board meeting on January 9th, the board passed initial adoption of the state plan amendment for TCMs effective July 1st, 2025. An opportunity for public comment was held on January 15th, 2025 at 1:30 p.m. via Zoom. Written comments were due on or before January 22nd, 2025. There were neither written or oral comments received. Therefore, I request support for the final adoption of therapeutic care model for submission to CMS.
Thank you. Any questions of Michael from any of the board members? Hearing none, we'll entertain a motion for final adoption.
Hopkins, so moved.
Seconded, Kathleen Ruth.
Dr. Hopkins has made a motion for approval. Dr. Ruth has seconded. Any further discussion? Hearing none, all those in favor signify by aye.
Aye.
All opposed, no. Anyone abstaining? Motion carries. Thank you.
Thank you, Mr.
Okay, thank you. Thank you for your presentation.
Thank you, Mr. Chairman. Thank you, Board.
We'll move on to our second item to consider for final adoption. That's rules and regulations for criminal background checks. Melody Simon, our general counsel, will present that. Melody?
Good
Morning.
morning, Mr. Chairman, Commissioner Carlson, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption for criminal background checks. These rules are found in Chapter 111.812 of the Department's Rules and Regulations. The revised rules add adult residential mental health programs to the list of facilities that are subject to the requirements of the Georgia Long-Term Care Background Check Program. This program under state law requires a fingerprint criminal background check for the owner, administrator, and direct care staff of the facility. An opportunity for public comment was held on January 28th, 2025 at 11 a.m. via Zoom, and written comments were due on or before January 28th, 2025. No oral or written comments were received during the public comment period. Accordingly, we are requesting consideration for final adoption of these rules today, and I am happy to answer any questions from the board.
Any questions from the board for Melanie? Hearing none, we'll entertain a motion for approval for final adoption.
Motion for approval, Cynthia Rucker.
Dr. Rucker has made a motion for approval. Do we hear a second?
Shane Mobley, second.
Shane Mobley has seconded. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Thank you, Melanie. We'll move on to your second item, rules and regulations for personal care homes.
Thank you. The Division of Healthcare Facility Regulation presents rules today for initial adoption for personal care homes. These rules are found in Chapter 111.862 of the Department's Rules and Regulations. The primary purpose of these rule revisions is to implement the provisions of House Bill 1335 from the previous session of the Georgia General Assembly. We do have two changes that are not related to the legislation, so I will review those first. The first change is to add an exemption for medical foster care homes that are regulated by the U.S. Department of Veterans Affairs. This request came from a Georgia location of the federal agency, and these homes are already inspected and regulated by the federal agency, so there's no need for additional state oversight. The second addition that is not part of the legislation is a new provision to make it easier to onboard staffing in memory care. Currently, the requirement is for 16 hours of specialized training on Alzheimer's and related dementias for staffing in memory care centers. This provision would provide for portable training for up to 12 hours. And this is an initiative that's being developed by some external stakeholders that has broad support from both the advocacy community and the provider community. So this will just provide some additional flexibility, and the department, of course, would approve that training, and there would be a competency exam associated with it as well. And then finally, there are a number of changes related to staffing that were a part of House Bill 1335. First of all, they're removing the requirement to have one staff person on each floor of the personal care home if the facility has a medical alert system. The facility must offer non-memory care residents a wearable sensor alert device so that they can request assistance when needed. Residents cannot be required to wear the device. The medical alert system sends a signal either to portable electronic devices worn by staff and/or to a stationary system located in a designated area that is monitored by staff. The facility must have policies and procedures in place regarding the system and maintain the system appropriately. And this just allows, if the system is in place, this is not in memory care, but in other areas of the personal care home, it allows the staff to move about the facility, and the residents, of course, can use the alert device as needed. The second change is with regard to memory care staffing. It allows the medication aide or nurse to count towards the requirement of 2 direct care staff persons that are required under state law as long as they remain on site. We will have a public comment hearing on these proposed changes March 4th, 2025 at 11 a.m. via Zoom, and written comments are due on or before March 7th, 2025. And I am happy to answer any questions from the board about these proposed changes.
Any questions for Melanie?
Mr. Chairman, this is Shane Mobley. I have a question on the communication device. Has there been a standardization on what that may look like, or like some manufacturers? Because what you don't want to do is, as some of us know that sort of have healthcare backgrounds and been around these things, I know Chairman Folsom has a lot of experience, and just trying to make sure that someone doesn't have like an infant monitor type system, that it's actually a professional system. So do you guys have any like specific requirements as to how the communication system could work? Because I know the commercial grade ones are a lot different than, say, like the personal type ones that you would have. And is there any requirement for them? Let's say a patient is in room, 100 or something like that, and they have a lanyard around their neck and they press the button. Is that caregiver going to necessarily know? How are they going to know that that person from that room is where they need that attention to be at? So that's why I was wondering if there was any type of, thoughts regarding that on that communication device, which I think is an excellent idea. But some of these facilities can be big, and you don't want someone that needs assistance and then they're just trying to go from room to room trying to figure out who that they're, are supposed to help, if that makes sense.
Yes, absolutely. So yes, we did certainly review manufacturer requirements for these systems. We have all of the minimum requirements that were included in the statute, and we have added a requirement that it has to indicate the location where the alert is coming from. So that is a requirement of the system, that the individual wearing the staff person that's wearing the portable device, or if it rings a stationary desk, it has to indicate the location. And in the statute, it requires that it send that signal immediately, that it be immediately transmitted. So we do have those minimum standards included in the rules.
Okay, that's excellent. Great work on that.
Thank you for the question, Mr. Mobley. Any other questions for Melanie?
So yes, I have a question. This is Kathleen Ruth, kind of in line with Shane's question. What about maintenance on the medical alert system for the individual? Making sure that, if it's battery operated or however, that it's checked periodically to make sure that it is sending the correct, an appropriate signal to the right place. So.
We do have maintenance requirements included in the rules, a number of provisions on that, including checking the system in the event that there is any type of power outage or emergency situation. They have to do education for both staff and residents on how to use the system. If they have a resident that is unable to effectively use the system, then they would have to adjust their monitoring of that resident, because they can't require the resident to wear the device. And some residents may be non-compliant. They have to have policies and procedures in effect, and they have to check the system and make sure it's operating correctly. And the other thing important to note is this in no way alleviates the requirement that the personal care home meet the needs of the resident. So this is just an additional device that was put in place under state law. We do believe it will be helpful, certainly, in meeting resident needs, but it is not a substitution for other types of oversight that the facility will be providing.
Great. Thank you so much.
Excellent questions. Real working knowledge from our board members. I'm very pleased about that. Any further questions for Melanie? Hearing none, we'll entertain a motion for initial adoption.
Hopkins, so
Motion for
moved.
adoption, David Cruz.
Yeah, I'm gonna take that in order. I heard it, Dr. Hopkins for approval and David Cruz for a second. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
All opposed, no. Anyone abstaining?
I'm
Mo-
abstaining, Dr. Rucker, since it mentions federal, and I'm
Okay.
with the Department of Veterans Affairs.
Understand, Dr. Rucker, for the record, is abstaining from the vote. But the vote carries, and we appreciate your votes. We'll move on to the next item, Melanie, which is rules and regulations for assisted living communities.
Thank you. The Division of Healthcare Facility Regulation presents rules today for initial adoption for assisted living communities. These rules are found in Chapter 111-863 of the Department's Rules and Regulations. These really mirror the changes that I just presented on the personal care home rules. They are necessary in order for the department to implement the provisions of House Bill 1335. The only difference is we are not putting the medical foster care exemption in these rules because assisted living communities under Georgia law are 25 beds or more. So it's really not applicable to have an exemption in place for those medical foster care homes. But the other changes related to the portable training for dementia care and the staffing changes and the medical alert system are all included in these rules as well. We will have a public comment hearing on March 4th, 2025 at 1 p.m. via Zoom. Written comments are due on or before March 7th, 2025, and I'm happy to answer any additional questions. Thank you.
Any questions for Melanie? Hearing none, we'll entertain a motion for approval.
Shane Mobley motions.
Have a motion for Mr. Mobley for approval for initial adoption. Do I hear a second?
Second, Kathleen.
Dr. Ruth has seconded. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
All opposed, no. Anyone abstaining? Motion carries. Melanie, thank you for those three presentations this morning.
Thank you.
Does anyone have any new business that needs to come before the board? Or any comments regarding any matter that was discussed today? Well, hearing none, our next meeting will be March the 13th, and wish everyone a good remainder of February and a good afternoon. It's rainy and balmy here in Dublin, so I'm sure it is most of the state, looks like, from the calendar. The weather calendar I'm looking at in the corner here. Everyone have a good afternoon, and thank you for your participation.
Thank you, Mr. Chairman.
Meeting is
Thank you,
adjourned.
Mr. Chairman.
Thank y'all.
Chairman.